name is Brenda Budnick, and I'm the Aquatic Director here at North Central Healthcare. What makes this pool unique is the water temperature. It is at 90 to 92 degrees. It's fully handicap accessible from the locker rooms to the entry and exit of the pool. We have a pool ramp that leads into the water, and we use water wheelchairs to get in and out of the pool.
Traditional aquatic therapy was generally used to just decrease body weight on somebody to allow them to perform exercises. But now with the variables of compression that help promote circulation and decrease pain, along with the different forms of resistance the water can create, allows the pool to be used not just for those patients that need to be offloaded, but also allows us to work with a large variety of patients.
North Central Healthcare Aquatic Services exists to provide quality physical therapy and post-physical therapy care. We provide it in a safe, warm environment.
Hi, I'm Courtney Pfeiffer. I'm from Weston, Wisconsin. My whole family was involved in a car accident on July 6, 2011. My husband had a seizure while he was driving, and my 3-year-old twins and my 6-month-old baby boy were also in the car. Miraculously, they weren't hurt. However, I was. I broke my back in 3 different places and shattered my pelvis. When I shattered my pelvis, I paralyzed my right leg. I was hospitalized for 4 months. Spent some time in a nursing home, all while I had 3-year-old girls and a 6-month-old at home. The pool was able to give me pain relief where the doctors weren't able to. They were able to give me strength where the doctors weren't able to. Just physically being in the pool, not even doing any of the exercises, helps me calm my body, helps me calm my muscles, my bones, my nerves. And it's something that I can't wait to get to, actually. The pool has accommodated everything that I've needed to do in these past 4.5 years, to where early on in my injury, when my children were small, they accommodated exercises where I could physically get on the floor with them and be present with them. Now that my kids are bigger and faster, the pool has helped me become the mom that I need to be, walking at a faster pace. It's given me my life back. If I never was able to find the pool, there's no question that I wouldn't be in my kids' lives. I would have been able to watch my dreams crushed right in front of me. So this is everything to me.
My name is David Telesti. I live in Wausau. I have been coming to the pool for 24 years. I had a serious car accident that left me paralyzed chest down. This facility has allowed me to stay in my home, pretty much independent on my own. The cost that has been saved on healthcare costs. I have not had a hospital visit or any other medical problems. And the reason is the pool. You know, it's hard to exercise when you're fully able, but I can transfer in and out of bed. I get out, I can wheel up and down a ramp. The strength that I get from the pool allows me to even get on the lawnmower and mow my lawn. Those are things that I couldn't do without the pool. Staff are tremendous to give people a life of independence. The pool is old. We really have to consider make the changes that are necessary. We don't want to lose this. It's far too important. And I would say to anybody, everything is good today, but your life can change in an instant. So I would encourage people to really look of the results from this healthcare aquatic pool. Thank you.
Some of the many benefits of aquatic therapy are improved circulation, decreased pain, decreased inflammation, and support of the joint structures. The use of the aquatic environment allows for a higher repetitions to be performed within exercises. This higher repetition promotes the improvement of circulation and the neurological re-education, which is needed for most diagnoses. The compression of the pool helps us to work with decreased inflammation, which allows us to be more aggressive with certain types of injuries. The use of the aquatic environment to treat pain is improved due to the supportive nature of water. With the reduction of pain, therapeutic exercises then can treat the biomechanical deficits that are affecting the person that is causing the pain. The use of the benefits of aquatic therapy allows us to treat many different diagnoses.
I'm Hannah Headinga. This is Piper. Piper will be 4 in June, and she has a rare chromosomal abnormality called inverted duplicated deletion of the 8p chromosome, with kind of a secondary diagnosis of agenesis of the corpus callosum. So the first one is just a very rare chromosomal abnormality that causes pretty global developmental and physical delays. And then the agenesis that's the portion of your brain that actually helps the two sides communicate and bridges. So she's missing that portion of her brain. So we have done aqua therapy since Piper was about 18 months old and have just been so absolutely thrilled with the results that we've had from that. We saw really almost immediate effects of the benefits of aqua therapy, that she would do things in the swimming pool that she absolutely would refuse to do in regular physical therapy. And then what we would see is actually the carryover from the pool to then her physical therapist that was our land physical therapist saying, oh my goodness, she's never done this before. Why is she doing this? And me saying, because we did it in the pool first. So it's been really, really amazing for us. We can have days that we show up at the pool and say, she is so cranky today, I don't know how she's gonna do. And then she'll get in the pool and she will work for an hour really hard with a smile on her face pretty much the whole time. So it's really nice for us to have a therapy that we know isn't gonna make her cry and isn't gonna upset her, but that she's gonna have really great results from, and ongoing positive results that also that she enjoys. So that is why we really love aqua therapy in our family.
My name is Dale Verville. I'm 58 years old. When I was 21, I got shot off the top of the head, which caused a brain injury, which caused me to become a spastic triplegic. So my legs and left arm do not coordinate. The therapy runs out after so many dollars, and I was a slow progress to walk again. My biggest problem is spasticity, and because of the water calming my muscles down, that helps my spasticity to practice walking. The more I walk, the less spastic I get. Once I get the spasticity down far enough with repetitive motion, then I can practice using coordinated motions, and because of the pool, I'm able to practice this stuff on a regular basis without worrying about hurting myself. I've been using the pool for 6 years. Right now I'm going 5 days a week, so I've made this my full-time job. You're either gonna walk or you're not gonna walk, or you gotta give it a full shot. And this pool lets me try at least to get it a full shot. So please let me continue using the pool. It's a godsend, this pool. It really is. If I would have known this was here, I could have been doing this years and years and years ago, and I'd been walking by now. Instead of being a detriment to the community with Social Security disability for 35 years, I could have been one of the ones paying in taxes. It's inspiring to watch the other people try to help themselves, and I hope I'm inspiring some too.
All programs in aquatic services require a physician referral. This keeps us a therapeutic pool and not a recreational pool. We sometimes have multiple programs going on at the same time in the pool. The arthritis class is structured for those suffering from arthritis. It provides a gentle range of motion for the joints of the body with walking and noodle exercises. The fit class is conducted a little more vigorous than the arthritis class. You participate at your own pace, and you must be able to walk back and forth across the pool with no assistance. This class works on strengthening and endurance. The Community Open Fit is unstructured for individuals with doctor referral that will benefit from overall warm water exercise. Community Family Fit is unstructured for individuals and families. Children are welcome at this program. Our aquatic physical therapy program is billable to private insurance companies, the VA, Medicare, and Medicaid. After discharge from physical therapy, the individual has the opportunity to go into a step-down program, such as the Community Fit or the Maintenance Program. The Maintenance Program is not billable to most insurance companies, but is geared for the individuals who need assistance to carry out their exercise programs and to be safe in the water environment.
My name is Linda Jordan. A number of years ago, I was inflicted with something that took away the strength in my arms. And after many tests and ruling out a lot of bad things, I ended up at Mayo Clinic, where we came up with the diagnosis of bilateral brachial plexopathy of no known cause. I ended up having a treatment for that and was told that I needed to work very hard to try to get my muscle strength back. The aquatic therapy pool was suggested, but at the time I had resisted it a little bit because of getting in the chlorine and the cold, but pretty soon I realized that I had to. And I'm very glad that I did, because once I got in there, I could do range of motion exercises without gravity, using floats on my arms. And I'm happy to say that I've regained a lot of strength, still not enough to be entirely functional, but I can do way more than I used to be able to do. I started out in the aquatic therapy program working with the physical therapists, and once we familiarized myself with the different exercises, I'm able to come now whenever I want, which typically is 3 times a week. I can spend as much time as I want here as long as the pool is open. And one of the things I like about it as well is that I can get my aerobic exercise by walking in the water, which is something that I can't do by my own outside anymore. So it allows me to be way more independent than I would have been otherwise.
Hi, my name is Liz Fisher. I'm a Wausau resident. I have multiple sclerosis. I've had it for 25 years. Since coming to the healthcare center pool, I've had a lot of benefits. I've been a lot stronger. My muscles in my legs and my core have been quite a bit stronger. That keeps me standing better when I'm doing things around the house. My spasticity level has become less. Another big benefit for me has just been mentally. It's easy to become discouraged when you have a chronic disease that becomes more debilitating. The feeling when I get into the pool of independence and the social aspect is good too, to see other people benefiting and improving their life situations. Overall, my quality of life, even with my MS, has been much better since coming to the North Central Healthcare Center pool and exercising there with a program that was designed specifically for me by the physical therapist there. My MS hopefully will not be progressing as quickly as it had been. I've been so thankful for the pool. It has made such a difference in my life, and I'm really happy with the fact that I can go to a place where I'm independent and I'm in control of bettering my physical health.
Our programs emphasize patient education and assist individuals in maintaining their range of motion, strength, function, and to keep people independent, living in their own homes and being an active participant in their own health care.